Well, have you heard of facelifts? Well, we've all pretty much heard of facelifts, right? But what about lifts? I'm like, what is this? It is a smaller improvement that many are now getting to look better and to look younger. Maybe it helps with the kissing, too. Dr. Anthony Admir, a plastic surgeon here in Scottsdale, joins us this morning. Good morning, Doc. Great to see you.
Great. Thank you for having me.
So we're really interested in this. First, explain what is a lip lift. What are you doing for folks who want to get this?
Yes, it's a small surgical procedure. It can be done under local anesthesia, or it can be done in conjunction with other surgical procedures, such as a facelift. But primarily, what it does is it shortens the upper lip distance, and so you can kind of see some of these are my patients. And you can see how, as we age, the upper lip gets long and thin. And so the lip lift is just removing a little thin strip of skin underneath the nose. And by doing that and suturing it up, it tightens the muscles, tightens the skin. And you can see it shortens the distance from the nose to the lip. And so you can see a lot more of the red part of the lip, which is a youthful look, and what a lot of patients use fillers for.
So who are the best candidates for this?
So I would say most of the patients that I do this procedure on are usually in their 40s, 50s. That's usually when we start seeing the signs of aging, where the lip starts to get really thinned out. You see less of the red part of the lip, which is what we want to see, which is a very attractive part of the lip. So usually I would say 40s, 50s, 60s, but even patients in their 70s.
Oh, okay. So the neck, and I notice I'm like putting my neck cream on and all of that. But tell us what happens with the neck as well. I know you got some pictures of that.
Yeah. So it's my deep plane neck lift, and you can see how you can see those little bands, those vertical bands that we all hate and we see, especially when we see ourselves on camera and on Zoom calls. And so I make a little incision underneath the chin, and I tighten up those muscles. So, and you can see by tightening up the muscles that usually the skin then just gets redraped and produces a much better contour to the neck and to the jawline. So even in the side photos, which we don't see here, it really improves the jawline and the jowls.
So Doc, before we go, I think a lot of people are interested, maybe coming over the screen saying, oh, I like these before and afters. What's the cost, though, especially with the lip stuff?
Yeah, the lip lift isn't very expensive because it can be done under local anesthesia, and a lot of times in an office-based setting. It's primarily, I would say anywhere from $1,500 to $3,500, and depends on how much lifting is involved, how much muscle tightening is involved. Sometimes we do little additional procedures to help resurface the skin, and so the price varies a little bit. So, but a lot of people, or a lot of my patients, combine it with a surgical procedure, which that obviously costs more, but then you get a full facial correction with that.
So maybe a very generous Christmas gift with somebody who has a lot of cash. Doc, we appreciate it. Interesting to learn about this new trend, and we wish you well on this Saturday morning.
Okay, well, thank you very much. Thanks for having me.